What's Z, everyone? Have you ever felt that annoying tickle in your chest that just wouldn't quit? Or maybe you've had a cough that just wouldn't go away? If so, you might have experienced bronchitis. Don't worry, it's a common respiratory condition, and I'm here to break it down for you. In this essay, we'll dive into the world of bronchitis, exploring its symptoms, causes, and treatment options. By understanding this condition, you can take control of your health and breathe a little easier. So let's get started. Bronchitis occurs when the lining of your bronchial tubes, which carry air to and from your lungs, becomes inflamed. This inflammation narrows the airways, making it harder for air to flow through. There are two main types of bronchitis, acute and chronic. Acute bronchitis is like the common cold of bronchitis. It usually comes on suddenly and lasts for a short period, typically a few days to a week. Chronic bronchitis, on the other hand, is a more serious condition that lasts for a longer time, often months or even years. It's important to note that while both types of bronchitis share some similarities, they have distinct characteristics and require different approaches to management. Bronchitis often announces itself with a symphony of symptoms that can disrupt your daily life. One of the most common symptoms is a persistent cough, which may produce mucus. You might also experience shortness of breath, especially during physical activity. Other telltale signs include wheezing, a tight feeling in your chest, and fatigue. If you experience these symptoms, it's essential to consult a healthcare professional for an accurate diagnosis. Remember, self-treating can be risky, so it's always best to seek expert advice. Causes and diagnosis. Unraveling the mystery of bronchitis. Acute bronchitis is typically caused by viral infections, such as those that cause the common cold or the flu. In some cases, bacteria can also be the culprit. Chronic bronchitis, on the other hand, is often linked to smoking, exposure to air pollution, and other lung irritants. Diagnosing bronchitis usually involves a physical exam and a review of your medical history. Your doctor will listen to your lungs for any abnormal sounds, such as wheezing or crackles. In some cases, further tests, such as a chest X-ray or a sputum test, may be recommended to rule out other conditions or to determine the underlying cause of your bronchitis. Treatment and prevention, taking charge of your respiratory health. The good news is that acute bronchitis often resolves on its own with time and rest. However, there are steps you can take to alleviate your symptoms and support your body's healing process. Getting plenty of rest, drinking fluids, and using a humidifier can help soothe your airways and loosen mucus. Over-the-counter medications, such as pain relievers and cough suppressants, can provide relief from discomfort. For chronic bronchitis, treatment focuses on managing the underlying condition and preventing further lung damage. This may involve quitting smoking, avoiding lung irritants, and taking medications as prescribed by your doctor. Prevention is always better than cure. You can significantly reduce your risk of developing bronchitis by adopting healthy habits. Washing your hands frequently, avoiding close contact with sick individuals, and getting vaccinated against the flu and pneumonia can help prevent infections. If you smoke, quitting is the single most important thing you can do for your lung health. Remember, knowledge is power. By understanding bronchitis and taking proactive steps, you can breathe easy and enjoy optimal respiratory health. If you have any questions or thoughts, feel free to share them in the comments below. Let's start a conversation about healthy lungs.